So welcome. My name is Jessie Donaldson. I'm the EVP of Strategic Services here, and had the great pleasure of co-leading this work with my new colleague here, Michael from AMO, and I'll let him introduce himself in a minute. Thanks for joining today, and I see a lot of Ontario names, so I hope this isn't boring for you, but we're going to go through some of the data that you may or may not have seen, but we're also going to go a little bit behind the scenes and share some of the lessons learned, what this is, what this isn't, and for communities not in Ontario, give a little bit of insight on what I think is a really possible thing to duplicate despite the differences that exist in regards to homelessness across the country. So thanks for joining us today. Really appreciate it. I think our presentation will take about half an hour. I'll try not to drone on, and then we'll have lots of time for question and answer. So let's kick it off.
Great. Jesse, maybe I'll introduce myself and say a few words about the genesis of the project. Thanks, and happy to be here to talk about this research study. Really think it was groundbreaking from our perspective, and was very pleased to partner with Help Seeker to undertake this research. And of course, we're talking about the report released in January of this year called Municipalities Under Pressure, the Human and Financial Cost of Ontario's Homelessness Crisis. And just to introduce myself, I'm a senior advisor with the Association of Municipalities of Ontario. Before I talk about myself, I'll talk a little bit about my association, just because I know there's people from across Canada on this call. AMO is a nonprofit association. We represent the 444 municipalities here in Ontario. We essentially act as the voice of municipal governments. We do that by developing policy, undertaking advocacy, providing various business services and membership education. I would say that AMO is a political organization, as our members are municipal councils, and our association is governed by municipal elected officials such as mayors and regional chairs and wardens, but we're strictly nonpartisan. We act in the municipal institutional interest, but we do work on issues such as housing and homelessness. So a little bit about myself. My role is to advise the Association of Municipalities of Ontario and our municipal members on social policy, accessibility, immigration, and education, and further to promote our policy positions to the provincial and federal governments through government relations work. That's my primary function, and it's fair to say that the biggest focus of my work on a weekly basis is on homelessness and housing. Maybe I'll just say a few words about what the driver for the research was. If you're familiar with the report, this was something that we commissioned basically to get a better picture and a better understanding of homelessness here in Ontario. Homelessness is really a top-of-mind issue for AMO and our municipal members, and we also had a couple of project partners, the Ontario Municipal Social Services Association and the Northern Ontario Services Deliverers Association, and we agreed that research of this nature was essential and very timely. For those of you in Ontario, and I'm sure there's some situations across the country, the homelessness crisis is really at a tipping point and taking a huge toll on people and communities, and our municipalities are under great pressure, as reflected in the title of the report. They're feeling the impact of the crisis on the front lines of their communities, and just a fact that in Ontario, the municipal role is perhaps a little different from other provinces and territories. We are legislatively responsible to provide social housing and do deliver homelessness services. We do receive federal and provincial funding to be able to do that, but we do put in a significant amount of municipal funding to get that work done as well. And we do that in conjunction with community partners, nonprofit organizations, and cooperative housing providers. So the driver for this research is our board for the last few years has really placed a high priority on homelessness. We're committed to ending homelessness, starting with chronic homelessness, especially for unsheltered people living outdoors. And we have around 1,400 encampments in Ontario, according to the data that we've collected. That's quite significant for us. So we set out on what we thought was going to be an ambitious research project about the homelessness crisis to gain that better understanding of where it's at, where it's going, and what it would take to end chronic homelessness in communities across the province. So this study was really unprecedented for us. It's not something that we've done before. To our knowledge, the province has not undertaken a study of this nature. But we're pleased with the outcome. We believe it's a great platform for conversation with government and with the sector partners and community. And we were really pleased to work with Help Seeker, with Jesse, Alina, and the rest of the team who did the heavy lifting and the excellent work collecting the data, analyzing and modeling. You will see that in the quality of the report that's being presented. So at this point, I think I'll turn it over to Jesse, who I understand is going to walk through the report structure and the findings. And later at the end of the presentation, I'm happy to talk about the implications and the influence of the report so far and answer any questions. Thank you.
Thanks, Michael. And I see Alina stuck in here. Hey, Alina, welcome. We have another special guest.
Ignore me, Jesse.
Okay.
I wouldn't do that.
Thank you. Before I start, I see a lot of Ontario names, and I want to acknowledge some thank yous. First to our team. The real brains behind the operation is not actually on this call. It's our data team and the work that they did, and I'll try to do justice to that today. I also secondly want to thank the service managers, and the kind of political will and the human resources that went behind this was significant, and I appreciate it put a burden on some of the data teams. So thank you to service managers. If you're a frontline worker and you're in a service agency, particularly in Ontario, we recognize that you also have a data administrative burden that you're collecting and you're sharing. And then the final thing I'll note is the reason that we have data is because people are experiencing homelessness and they're sharing their stories and their experiences and their demographic information, sometimes over and over again, in order to seek help and seek housing. And so remembering where that data came from and why we have it, and then what we then need to do with it, our kind of responsibility is something we kept top of mind. I see a hand. I don't know if that's a rogue hand or we're good. Okay. So thank you everyone on the call. And if you're thinking, oh, Ontario's structure is a little bit different, we in our province don't have mandate for housing and homelessness, this wouldn't be possible. I've been thinking a lot about it. I do think there are a lot of ways this can be done, irregardless of Ontario's legislative structure. So part one, that's the part that we thought would be the easy part. And it took us almost 8-9 months of the year-long part. So that was mapping current state, collecting the data we had from service managers, getting additional data, and then also kind of developing some standardized definitions and methods to aggregate that data. And that truly was the biggest lesson learned for us. And I hope to share some of that with you today. Part two is the projection modeling. So that's the fancy data stuff, and that comes from our data science team. And really, it's not meant to be an operational projection. It really is a policy function. It's able to say, hey, if we don't do anything, this is what homelessness might look like over the next 10 years. The final was the modeling. So it's not enough to just say, hey, this is how bad it is. How might we build, invest, think about our way out of this? And so we did 2 scenarios. I'll talk about what scenarios are and aren't. The great thing about scenarios is that they can be done provincially, they can be done locally, fairly easy with your own data. So we'll talk about how that's applicable and how we thought about it in the context of this project. Okay, a few kind of 101s. Forgive me, Ontario people, but I do want to be inclusive of our other guests. So we have 47 service managers in Ontario, like Michael mentioned. The data we used is a combination of by name lists, point in time count, shelter data, administrative data, financial data. We also looked at some data that went from service managers to provincial funding on provincial parties on funding, et cetera. So we used diverse data sets, but largely it came from those as far as people experiencing homelessness. Totally understand the asterisks. Those are all deeply flawed in their own way. And we worked really, really hard to try to compensate for some of those flaws in a conservative but accurate way. We also combined it with census and socioeconomic data. So for the projections, we looked at how different economic factors change over time and how that might impact homelessness. And then just a few definitions. So chronic homelessness, we use the federal definition. So that means someone's experiencing homelessness for 6 months in the past year or 18 months over the last 3 years. We know definitions are different all over the country, all over the province, but this is the one we tried to stick to. Functional zero, so that's from our friends at CAEH. The goal is actually Alina as well. So homelessness is rare, brief, and non-recurring. So we know that an end to homelessness, people will always, unfortunately, or mostly who are at risk of homelessness, find themselves experiencing homelessness. But are we able to move people through the system with minimal impact, minimal kind of individual and family trauma, and minimal community impact? Known homelessness. This is a definition we use. So when we say things like, spoiler alert, 81,000 people are estimated to have experienced homelessness in 2024 in Ontario. That is what we're saying known homelessness. So people who are known to the system. It may include a little bit of hidden homelessness, but largely it's an underrepresentation by virtue of us only focusing on who we can know. So undercounting risks, of course, and then there's regional differences all across Ontario, which I may or may not get into as we go through. And then my final kind of level setting is the role of service managers. Michael explained it quite well, but under Ontario's Services Act, service managers are responsible, and this is unique for managing and funding social housing programs, overseeing shelters, emergency homelessness prevention, developing plans, et cetera, et cetera. By virtue of that, they do have access to data that maybe some other municipalities don't have because you don't have a mandate for homelessness and housing. But again, I don't want to let that discourage you. If you're thinking of doing something similar in your region or province, there are ways around it. Okay, part one. So here's what we did before the big reveal. We met with 47 of the service managers, and we had a series of workshops and a survey on what data they collect, how they collect it, what were the pitfalls, what were the pros, where was it strong, where was it not, and how far back did we want to go. When my data science team came to me and said, we're going to collect data from 2016, I said, that is crazy. So no one has data from 2016. I was wrong. There are a lot of communities with fairly good data dating back to 2016. And so by virtue of us trying to collect so far back, but creating a standardized template for people to do so, we were able to collect a lot more data than I thought we did. One of the things we had to do in the course of this template is we asked of how many people were experiencing homelessness and how do you know? What data source are you using? And we were really, really careful to itemize whether people were using a pick count, which is a snapshot, a daily kind of a 1 day in time, whether they were using a by name list poll, which is actually ends up being sort of 3 months, whether they were using an annual number or whether they were using something entirely different. And by applying that rigor sort of in the template, what it allowed us to do was everyone could contribute. So 100% of the service managers were able to contribute, but they were able to contribute kind of what they had. And I've been in homelessness policy and research for a long time, and the kind of different ways of measuring has been the bane of everyone's existence. And that's, I think, limited our ability to kind of come up with these numbers. So we said, give us what you have. Ideally, you give us the annual, and if you can't do that, give us the monthly, and if you can't do that, give us the PIT, and if you can't do that, give us your best guess. And by doing that, we were able to then really kind of methodically figure out how to annualize some of those numbers into a number that we feel is conservative, but we're really confident in. And so I'll talk about in my lessons learned, but creating a template that everyone can participate in is far better than creating a hyper detailed template with the perfect kind of data requests, because nothing will ever happen. You'll never actually get to the analysis and the publication part. I take no kind of joy in these, but I think for most of you on the call, it's probably not surprising. So what we found was 81,515 people experiencing homelessness we've estimated in 2024, which is a 25% increase since 2022. This is from 100% participation. For the actual annual totals, we had all 47 service managers report 2022, 2023, 2024. So I say this because I bring this to you with a great deal of confidence and one info that we should kind of really pay attention to. Within that, we found 41,512 people who are experiencing chronic homelessness, making up of 51% of all cases, which is a tripling since 2022. And I think for those of us who have kind of been in this research area for a while, that 51 is sort of is shocking. We would conceive chronic homelessness previously as a term for very entrenched homelessness. We would imagine a single adult males as chronic homelessness, and maybe 5–10% of your population. So the fact that we're seeing an increase in homelessness while a greater proportion of people who are experiencing chronic homelessness indicates that more people are moving in and less people are moving out. And I think that's what most of us are experiencing on the ground, whether we work in this or not, and it's simply going outside. And then we also, because Ontario is in charge of kind of social housing, found 268,000 estimated, 268,000 households were on wait list for rent geared to income housing, which I'll show you far exceeds the actual number of units. And there are no more RGI units coming. What we have is what we have. And so what we see is, to me, what represents an anvil over our homelessness response system that's trying very hard to move people out without the right spaces, and continuously people coming in, and which is unfair to people working in this, and it's unfair to people experiencing it, and it's unfair to our communities. One of the things I'm most proud of, and with deep appreciation to any of the northern communities who participated, who are on this call right now, is the quality of data from the northern communities, that we were able to make these estimates, not just kind of overall in the bigger urban, but we were able to also talk about the northern perspective and the rural perspective. And so, of course, overall, the number of people experiencing homelessness in Ottawa, Toronto is more. But when we look at the number of people experiencing homelessness in the north, so we estimated 5,377, which again is 100% participation from the 11 northern kind of entities in charge of homelessness, we actually see that it represents a 204% increase. So fine, there are fewer people overall, but the rate of homelessness is increasing in the north, and that doesn't even factor in the number of people who have to leave northern communities to come to southern communities, Ontario, to access services. So we can estimate that that's perhaps kind of much higher. I'll just let you see that for a minute. Similarly, it's something I'm proud of, and I hope we can kind of continue this work for those on the call, is we saw that in rural communities, similarly to northern, we see 154% increase. So fine, overall, mostly rural communities have fewer people, but we're seeing a dramatic increase. And also because it's known homelessness, we also have to factor in the level of hidden homelessness in rural communities and the number of people who've had to leave their natural networks and their communities to come to more service dense areas. So I think as one of the benefits of doing this in a provincial picture is being able to kind of tell that story without the boundaries of our municipal lines. This, and what I was speaking to earlier, this is where my head starts to go, oh, okay, like, so increase in gray, number of people experiencing homelessness. And what you're seeing in blue here is the proportion of people experiencing chronic homelessness. If you look at nothing else, all you should see is that people are getting stuck in a system they were never designed to be in. And we continue to have more people experiencing it, and without enough spaces or the right spaces, we get people exiting and coming back, or we simply have families and children sitting in our shelter system for 1, 2, 3 years. And so this is sort of where we say at a tipping point in the report is what we're meaning is, hey, this is not tenable. We need drastic action to get out of this paradox. Similarly, we were able to do this in northern communities, and the pattern holds true. So when we look at rural, when we look at northern, when we look overall, roughly half of people experiencing homelessness have been experiencing it for more than 6 months or more than 180 days in 3 years, if I got that right. This was surprising to me, that one of the, can you guys go back and check to make sure that's right? So 25% of people experiencing chronic homelessness are children and youth. We had some conversations with service managers as to why that might be the case. Some shared in larger communities that they have families sitting in their crisis response because of such a low vacancy rate in private market rentals for larger units, and then almost no larger units as far as affordable housing goes. So even if you apply a rent supplement, good luck finding a 4-bedroom apartment anywhere near somewhere that a single mother can access both childcare, school, and work. So that's one of the issues we're hearing. I do think there's something more to unpack about this 16 to 24. There's still 11% who are chronically homeless, and as well as children. Of course, we see seniors. I expected that to be a little bit higher, but I do anticipate as our population ages that we'll experience a uniform kind of stuckness of anyone experiencing homelessness within the crisis response. In the report, I hope I made this damn clear, and I will make it today. I do believe this is an underrepresentation, and by no fault of my data team or the service managers, but by virtue of us using the concept of known homelessness known to the system, there are so many systemic structural barriers to why Indigenous people may be not known to the system: discrimination, racism, shelter policies and bans, unfair shelter policies and bans. The fact that we did not include First Nations was not within the scope of this. We focused on the 47 service managers, so we have no way of knowing the number of people who are impacted on First Nations who are there, and also may not be identifying within kind of data collection methods because of the colonial history of some of those data collection methods. I do know when we do pick counts and they're Indigenous led and culturally led, the percentage of people who identify as Indigenous are higher in many communities than when maybe in 2016, 2018, that wasn't a common occurrence. Nonetheless, if you take these numbers as is, they're unacceptable. And so 5,000, estimated 5,000 Indigenous people within the service manager ecosystem reported as chronically homelessness in 2024. When we look at the northern communities, we see that upwards of 50%. And so for those on the call, really interested to kind of dig in this further and think about how this work with permission may be extended. But I think this is an area for further research, action. We probably don't need more research, we need action. Again, an aha, I guess I was surprised the whole year, but refugee and asylum seekers, and I bring this to you today with caution and concern. I think in the political environment, and not even political, but kind of the rhetoric and the social media environment that we live in, and the us versus themism, and some really awful, frankly, hate speech. I'm concerned about the narrative about refugee and asylum seekers, and that's who's using our shelter system. And certainly in response to the report, we did see a lot of that if you went on certain social media platforms. And so unequivocally here today to say the crisis response is intended for everybody who's here, including refugee and asylum seekers. I also think there's a whole kind of immigration and settlement department that needs to be working closely with service managers and the homelessness crisis response to ensure that we are fairly setting people up for success according to our values. So we found 10,552 refugee and asylum seekers who were chronically homeless. So that means people are coming and people are sitting in a crisis response that, again, was never intended to. We did have conversations with service managers, and sometimes we heard it was about the huge increase in how long hearings are. So hearings used to be a few months away, and now they're seeing them in a couple of years. A lot of it's related to income and benefits and affordability and a lack of vacancy rates. Nonetheless, it's not good. So 147, I can't speak, 475% increase since 2021. And that is a faster, bigger increase than simply the number of refugee and asylum seekers we've brought in. So that should give us pause that there's something not working. Here, and very fortunate to have this data. I said 268,000 at the outset that we had estimated. That's the number we had adjusted. 232 is what we got from the data. And so here you can see this dark blue, the darker one on the left. That's the number of units. And then on the right, that's the number of households on the wait list. And so that's it. It doesn't take a data scientist to say, hey, this isn't going to work. We have a significant misalignment of supply and demand. There are other programs within Ontario legislation of in-service managers. We have rent supplements, portable housing benefits. One of the challenges of those, though, is they're tied to private market units. And so you can flood the system with investment in those. But if you don't have housing plans or enough housing starts, and we've seen a decline in housing starts, or a vacancy rate, or accessible apartment buildings that are affordable where people need them, then rent supplements are only going to get you so far. So this misalignment between affordable housing, the actual units, and the wait lists is one of the things that's driving the inflow into homelessness. Finally, and again, was really kind of grateful for the service managers who took the time to pull this data and aggregate it in a way that made sense. But what we can see, and I suspect is similar across the country, is an increasing investment from within this ecosystem, homelessness and increasing investment from municipalities in homelessness and housing, and frankly from the provincial government on Ontario. I know Ontario's just kind of released some additional funding, but as a proportion overall of what's already going into the system and what's needed, probably more is required, if you will. Part 2, how am I for timing? Okay. So this is where we did the projection modeling. We took all of the aggregate data, and then we played with census indicators and different socioeconomic indicators and said, if this, then this. So what if the economy gets worse? And that's a question we seem to be asking ourselves a lot in Canada the last 2 weeks. What if core housing need increases? What if this increases? How would it affect this? If core housing need increases, how will that impact people with mental health or substance use concerns? And how might that impact homelessness? This is detailed which kind of levers we pulled in the back of the report in the technical appendix, but all that's really important is that if we kind of do nothing, we chug along, if we're optimistic here, 165,915 people estimated to experience homelessness if we kind of business as usual within the province. If we were to experience an upturn, 128,000, and then a downturn, nearly 300,000. I will impress upon you that we were only able to do this because of the level of data we have from the service managers, but the actual number of indicators we used from each to do this was not a lot. So if you were trying to reproduce something like this in your own province, this is something that's quite doable should you get kind of the agreement to do so. Northern Ontario, again, follows that sort of more steeper trajectory, can never say that word. So with a downturn, approximately 30,000. And frankly, again, as we're seeing, when we look at kind of the market conditions across the country, but within individual communities and in regards to housing, not to be a pessimist, but we don't see really a way where that steady or that upturn scenario is what we're heading to without some kind of significant change or signal. And finally, let's do the investing solutions. Not embargoed. You're free to share this. Projection modeling. So projection modeling is not predictive modeling. It is a series of choices, inputs and outputs that you change levers based on the best available information you had. And so what we did is we took the average operating cost, we took the capital cost for each program type, we took the total capacity that we could find based on what we heard from the service managers, keeping in mind there's capacity outside the system, but we knew the service managers represented a major portion of the capacity. And then we modeled against, okay, if that's what we have, and this is the estimated need, how might we close the gap between those two things? One of the things that's important, and for anyone who's heard me present, I'm so sorry for repeating it, but we mapped, or when we do projection modeling, we project not a utopia, but we do project an ideal. And that means two things. One, we assume kind of a baseline functioning of the system, that the system is operating and performing as it should. It would be unethical for us to model a poorly functioning system. That's not why we're all here. The second one is it also presumes that there's proportional investments into mental health, into treatment, that there's appropriate child welfare policies, that justice policies aren't releasing people from prison into homelessness, that there's appropriate social assistance adjustments. And so that is because the homeless serving system is not intended to fix all of those ills. It just has to deal with them. And so if you think, oh, well, that's not going to solve homelessness. Well, no, this and appropriate investment into the other policy areas, we believe is an avenue to address at least ending chronic homelessness. So we said 11 billion over the next 10 years, with the two caveats I said, appropriate investments elsewhere to achieve a functional zero in chronic homelessness. We made a choice, and it was a choice. We modeled prevention, supportive housing, and transitional. We didn't model additional crisis response and emergency shelter, despite the fact of the pressure on the crisis responses, because those aren't housing spaces. And so we took the full 11 billion and put it towards reducing the inflow and finding appropriate spaces for people to be. So 75,000 net new spaces, supportive housing for people with medium to medium high complex needs. There's a whole other supportive housing system that we need to rapidly prop up for people who are experiencing a much higher acuity need. Transitional housing to move people out of shelters who are sitting there for 1, 2, 3 years. If that's the case, let's put them into semi-permanent housing. And then affordable housing to stabilize low income. And then we put a whack load of money into the prevention programs with the caveat that we require the private market rental system to be appropriate to do so. We believe with those investments, if you were to spend 11 billion, that this mix would allow for over 10 years an ability to achieve functional zero. The second one, take the first one out of your mind. Don't try to combine them. You'll make your head hurt. Second one, it was a different scenario. We said, what would it take to jumpstart the system? So with respect to the significant harm individuals, families, and communities are facing with people and loss of life, preventable loss of life, with people living outdoors, people living in encampments, what would it look to switch that? And so what we did is we took a $2 billion starting point and said, how might we impact that? And we believe, based on estimated numbers, that 2 billion could, if not end, radically transform the number of people, reduce the number of people in encampments. So 2 billion over 3 years. We focused on 57 new housing spaces, that should say supportive housing. So we focused on supportive housing, some of that higher acuity, which we believe would transition about 8,443 people based on turnover, keeping in mind we had aspects of prevention and rent supplements in there as well. Not everyone in encampment needs supportive housing. That's so 3 years with an additional 5 years of support. I'm going to let Michael kind of maybe speak to this, or Michael, you don't have to, but one of my biggest takeaways was this work would have been wasted had AMO and service managers and other parties not focused so much on what are we going to do with it? What are we going to say? Whose hands are we going to put it in? How are we going to keep this moving? And still today, every day we see articles come out. And for me, that's a point of pride because we've done a lot of great work at Help Seeker and others across the country. It doesn't see the light of day or it's very quickly shelved. And so I think the work was amazing, but what's happening now with it towards, I hope, action is really the more important piece. Michael, I don't know if you want to talk to this.
Sure, absolutely. Yeah. So yeah, we were, since the release of the report, we've been pleased with the receptivity to it. And I would like to echo the thanks that Jesse mentioned to all the municipal staff and elected officials that provide leadership to contribute to the success of the report. It couldn't have been done without them. And we've been promoting this report as a platform for conversation. We really feel that Ontario is at a tipping point at the homelessness crisis, and this research study clearly shows the growing cost to individuals, families, and communities and governments, and it does really chart a course forward. Not an exact roadmap, but enough information that we need to sit down at the table and have a good conversation, because we know that the homeless crisis is severe and getting worse, and we're really keeping an eye, particularly on the modeled projections. Very concerning that in a steady state that it will increase in the absence of new interventions, and even much higher and significantly so in an economic downturn. But with the release of the report, it did receive some good media coverage. It has been echoed and cited by many sector partners. So thanks to people in community in different sectors, whether it be social, labor, or health, that sort of reinforce the importance of the study and the need for this conversation about how to address homelessness by reducing, preventing, and ultimately ending it. Yeah, and it's sort of made its way into the conversation in the current election campaign that's underway in Ontario right now. We will see what happens with it, and AMO will certainly, with our partners, will be wanting to engage, the new government once in place at the end of the election, which is happening at the end of February.
Thanks, Michael. If I could impart lessons learned, pieces of wisdom, accuracy is king, but perfection is the enemy of progress. And so we made thousands of decisions methodologically every day over the course of the 8 months. And we did so with painstaking commitment to accuracy. But we also knew we had to keep moving. And so nothing was going to stop us getting to an answer. And our goal was that we were going to get to the most responsible, most sound, ethical answer. And so one of the things, again, I think we've seen throughout enumeration of any topic, homelessness, mental health, substance use, is us getting so stuck in the details of it having to be absolutely perfect. And I don't know if that does justice for any of us, but we're not really about us, about people experiencing homelessness and leading to action. And then when in doubt, be conservative. And so when we had to make choices, when we were doing kind of linear models, when we were looking at additional research, when we had to decide between this or this number, we always went conservative because our goal was not to sensationalize an issue that we already know is significant and extreme. So our purpose was not shock value, and unfortunately the numbers are shocking, but accuracy. And if anything, the ability to say this is at minimum the number of people experiencing homelessness. We, like I mentioned, prioritized full participation over perfect knowledge. And so there are some service managers in Ontario and across the country at municipalities who have really, really amazing data. And if we set that as the bar, then we would have, a couple people being able to participate. So what we wanted to do was create a system that was logical, that was methodologically sound, but allowed for as much data as we could get in there, and then make really clear caveats on when we think something's 100% of an estimation, when we didn't think it was 100%. And so I hope in the report, for those that have read it, you can see that we've tried to be really transparent about what we do know and what we don't know. Template development takes more time than expected. So trying to figure out a system that everyone can contribute to, that was a rookie mistake. I thought we'd be done that in a month. It took us a long time. And also with respect to the contribution of the service managers, it wasn't always the easiest process. So I appreciate the ability to go through it. But even having a template that reconciles kind of how financial expenditures into homelessness are versus how many people are experiencing homelessness versus what the bed capacity you have, that's systems planning 101. So be able to kind of do that at a provincial level is quite cool. And out of doing it, regardless of whether you're trying to undertake a project like this, has a lot of value locally. Local interpretation of the template takes time, so you can create the best template you can, and then you just need to sit together and say, what does this mean for our local region or our municipality, and how does our data fit in, and how do we interpret this? And that takes time and precision, and we didn't want to rush that. We wanted to know as best as possible that we were adding apples to apples, not apples to kiwis. Political will and shared commitment are essential. No way, help seeker emailing service managers and give us your data. That's not going to work. So I think the commitment of AMO to do the right thing and the space they gave us to do something that was methodologically sound, but also the shared commitment across municipalities with frankly different interests. Like every municipality has slightly different interests. And so the ability to come together and to do something that was for the kind of common good with a lot of alignment was impressive and I think necessary. And then, like I said, don't build what won't be used. And so, you might want to know about international students. So did we. We might want to know about every experience a person experiencing homelessness. Yeah, so did we. But collecting that information and slowing down the process for information that you wouldn't have been able to publish because you don't have it at an aggregate level isn't useful. And also the fact that there was so much investment in how this will be used, not just doing the work, I really appreciate and respect and happy to see that that's moving itself into action circles, not just research circles. That's it for me. Michael, did you have anything you wanted to add?
No, I'm really glad that you finished this presentation with the lessons learned. I think there was a lot of things to learn from this, and from AMO's perspective, it's having the data in hand for evidence-informed policy making and decision making is absolutely critical. So we know there's some more work to do in that regard in Ontario.
Thank you. Oh, sorry, Michael.
Oh, sorry, and I was just gonna say, and this is really, set out a good precedent for what can be accomplished, and I know that we've all learned through the process about the ability to collect and analyze data through this, so that'll be very useful for us for years to come.
Awesome. My team, what do I do now? Questions.
So we can open up to questions. We got a couple here in the chat.
Okay.
And everyone else, if you have any questions, feel free to drop them and we'll go through them. So we have one here, Jesse and Michael. It says, are service managers and or their budgets organized in regions/pods? What are some of the regional variations in the report data?
Michael, I'm passing the ball to you for the dunk.
Yeah, for the the way the budgets are organized in Ontario, well, there's first of all the municipal service managers. There are municipalities and there are district social service administration boards in the north, which aren't municipalities, but they're service boards. As far as the municipalities are concerned, typically the budgets are. You could say it's organized regionally. There's single tier governments, but there's also regional and county governments that provide services for multiple municipalities, and they collect taxes and receive funding from the federal and provincial government to service their entire areas. And the same thing in Northern Ontario with the District Social Services Administration boards. They're sort of on a district basis, so they get levies from local municipalities, and they serve multiple municipalities in their service area. And I apologize. The second part of the question, if you could remind me of what that was.
What are some of the regional variations in the report data?
Jesse, did you want to touch on that? I think the main thing.
So one of the things we committed to in order to get kind of participation and to not make this a 10-year process is all service managers retained kind of complete control over their data, and we would only report at an aggregate level. And so we of course can see some differences with an asterisk. So the only regional analysis we did was northern versus non-northern, and then rural versus urban. I know there are some kind of groups within Ontario who are looking at how to take their data and do a regional analysis, but we did not do any.
Okay, another question here. Are there any thoughts about gathering data on how many of these families have pets?
Yeah, that's one of on the list of things I wish I could have known. That's certainly one of those things, because too, it's I think a barrier, and people going into crisis response, but of course then people being able to exit. So I do think that's something that would be interesting and useful, certainly. And we weren't able to, in the spirit of trying to kind of get full participation, we had to pick things that we thought most people, if not all people, had.
And then we got one in the chat here. Why did expenditure data need to be collected at the level of the 47 service managers? Could this information not have been extracted directly from the provincial or federal level to ensure consistency and reduce duplication?
Yeah, we did try. So funding versus expenditures versus information or funding announcements versus what actually flows through to specific programs are all wildly different and above my pay grade. So where we were missing financial data, we actually tried multiple times to reconcile it with publicly available sources, and none of it matches. So we had to make a methodological choice that, as in our ecosystem of service managers, we were going to use the most consistent data. And again, with our expenditure data, we had about 100% reporting, I think, through 2022, 23, 24, very, very high rates of compliance, if you will, for expenditure data. And that also allowed us to figure out what program, not just it was announced for, but that it flowed actually into. So yes, I agree that it seems nonsensical, but the publicly available and provincial data doesn't quite tell the picture of, is this money going into supportive housing? Is it going into shelter? Is it going into transitional? And doesn't quite tell us what's going into housing and what's going into homelessness. So absolutely agree.
Yeah, what would be the distribution mechanism and process for the recommended budget / dollars? A new bureaucracy or current systems of some combination of both? What new resources will be required? Does Ontario have the workforce to make it happen?
Yeah, that's a great point. And so going back to my concept of 11 billion is an ideal, not a utopia, or not a utopia, but it is an ideal. We didn't set out to say this is $11 billion. This needs to go to this community. This needs to go to this community. It wasn't a prescriptive kind of funding plan, nor can it be, because again, it maps an ideal. And so as far as kind of how that would be distributed, I'll love to hear Michael's opinion, but our intention was never, okay, this is how you're going to divvy it up between service managers. It was, this is how far we might get at an aggregate level if you were to invest a figure such as 11 billion, but it is really up to kind of the local expertise of the service managers and their autonomy to advocate for what they need. And maybe it's more, maybe it's less, maybe it's different. And so there are, through the service manager kind of mechanism, there's definitely room and capacity to flow funding through. And we've seen a lot of kind of funding lately being flowed through. But yeah, Michael, maybe you can be more succinct or eloquent than me.
Yeah, no, that was perfect. Do agree. I think what we need as a next step is to sit down with government to figure out what an investment plan look like, take stock of the situation, and in terms of specific allocations, it's really up to different provincial and federal funding models that determines where the funding goes. So probably an examination of those as well too, to make sure that resources are going to the right places and where they're needed most, and for the right services is a conversation that we'd like to have.
Okay, got another one in the chat here. From Jonathan, would you consider developing thresholds or performance indicators to allow communities to compare their progress with similar communities? This could help us assess our standing and identify potential efficiency initiatives.
Yeah, I would love to hear what sort of performance indicators, KPIs you're thinking. Certainly we'd be open. We as in HelpSeek are open to participating in something like that with a lot of collaboration and thought. But yeah, I think it would be a great idea, and where and how and who, it would be the question.
Awesome. I think we've covered all of them. So I think you're good to wrap up.
Okay. I had no magic last words. I really gave you all I had. But
Just
Michael,
wait,
is there...
wait. Sorry, I was gonna jump. We got one more question here.
Okay.
What were some of your lessons learned about the quality of homelessness data in Ontario? What do you think is needed to make improvements?
Yeah, I have a lot of thoughts about that. Is that from someone in Ontario?
Could be it's from Randallin.
Okay. Had we done this 3 years ago, and Michael, I don't know what you think, but I don't think if we had tried to do this 3 years ago, even 2 years, it would have been possible. I think when we looked at the historical data, we got way more historical data than we thought, but the level, the quality, as particular in the last kind of 3 to 5 years, you can see had improved significantly. You can see that there's a little bit of move towards standardizing of definitions. I think the ability, although it was challenging, the reconciliation of the financial data and then the kind of capacity and performance data, that was actually a better quality than I thought too. And so, of course, we all call transitional housing different things. We have different definitions of supportive housing. Some of us are using PIT, some of them did in October, some of us have never done a PIT. Like there's all these different things, and I won't pretend that those aren't real. But I'm seeing what we saw was an exponential increase in the quality of the data in the last few years. And I think we're headed in the right direction. I just also know that that's not always resourced at a service manager level well. And sometimes there's half a person doing off the side of their desk and they're doing a damn good job. So I hope to see some continued investment in that infrastructure, in those resources, in municipal, provincial, federal funding for people to do that work, because it would not have been possible without that. Michael, I don't know what you think.
Yeah, no, I just add that it's good to hear, Jesse, in your opinion, that things are improving, but we know that more work needs to be done. We need to build some capacity and maybe some discussion about what a data strategy for Ontario might look like in collaboration with the provincial government and perhaps the federal government as well.
Agree. It shouldn't take 8 months to pull it again, right?
Right.
Taj, is there anyone else?
Do have one last one here from John, who apologized in advance if it's a poor question, but said, I'm a layman just listening in. What's the risk of pouring money into housing? And then if you're looking back and saying that the housing is basically poorly managed or is trashed?
Yeah, not a poor question at all. And so, of course, warehousing people in housing, independent housing that they're not maybe prepared for or don't have the supports is not the goal. And one of the things we modeled was housing and supports of how do we support individuals, but also how do we have resources to support landlords to support individuals in that relationship. So I totally agree. And for people who maybe don't have the tenancy experience or barriers to taking care of apartment, or a network of people who maybe are going to exploit that person's kind of new apartment, then that's why it's really important we have supportive housing, we have more transitional housing, we have places where people can be supported either permanently or towards their journey of independence. I hate that word, but independence. So absolutely agree with you. It's why we need the right spaces for the right people, not just more.
And I'd agree with that. We need smart investments. We need more supply, but we need the right type and right mix of supply is definitely critical, and that was highlighted in the report.
Cool. Okay, we got one more has come up. It's from Anita. It's in the chat. Is there any context about funding to support operational costs of staffing slash trans? Sorry. Let me repeat that. Is there any context about funding to support operational costs of staffing support slash transitional housing? This is a huge gap.
Michael, I'm being a hog. Did you want to go first, or do you want me to?
Yeah, maybe you could start with what you think you learned. Yeah.
So we did, it was really interesting in the data. One of the, there's something happening here. We did ask for operational and capital costs average, operational per person or no, per unit for things like supportive housing and transitional housing. And why I know we have vastly different definitions across the country is the operational and capital costs, the operational particularly, were vastly different. So that tells me, regardless of regional differences in costs and acuity, that we have different conceptions of who we're serving, how we're serving them, how long we're serving them. There's something in there. So we did model operational and capital costs for both of those things. I do think there's a level of supportive housing specifically that that's not quite health, like not quite, but it is in between to serve individuals with an increasing complexity of needs, kind of brain injury from new drug compounds, that sort of thing. I don't think that's quite in our planning yet. And why I'm saying that is I think there's a supportive housing that's maybe missing in our continuum that requires a slightly higher, much higher operating that's still pre-health supportive housing. And I would love to talk about that with someone who maybe knows more than I do, but we did model it, but I think there's more investment to be had there. Michael, go ahead.
Yeah, and I think that's a great conversation to have again about the right type and mix of supply for people with different needs. I would say generally about the operating and the capital with relation to supportive housing. Yeah, there's definitely a need for more operating dollars. There are different pots of funding for capital, but often what we find is that we need the funding for the support services in supportive housing or in housing with supports, that sort of thing.
Okay, I got one more I think we can squeeze in. Has there been discussion regarding purchasing a hotel to provide housing and setting up supports, for example, mental health / addiction at the same time?
I could say that, you know, there's 40 different service managers in the province, and they look into different types of solutions based on local needs and circumstances. A model like that may be feasible in some areas, but not feasible in other areas. I can't think of a specific example of that model because we don't keep an inventory of all those services, but it is possible. If anyone had any information about a best practice in that regard, we'd be happy to hear it and disseminate that.
Awesome, that's it. I think we're good to wrap up. I think I can just close it down. Thanks, Jesse and Michael, for both doing this. This was awesome, and thank you everyone for attending. We will be sending out a recording afterwards as well as the slide deck. And if anyone has any questions, feel free to reach out.
Great. And I just wanted to say, you know, from AMO and my perspective, thank you so much to Help Seeker for putting on this webinar opportunity to talk again about this report.
Thanks for joining, Michael, and thanks all of you for joining, and happy to continue the conversation.